morning. I am Deborah Joyce, and I am here today to talk to you about the prescription drug abuse epidemic with a focus on opioids. America is faced with a significant health challenge. The president of the American Society of Interventional Pain Physicians and clinical professor at Temple University Medical School in Philadelphia, Pennsylvania, states opioids are now abused more than any other illicit drug or controlled prescription drug, surpassing marijuana for the first time. More Americans die from opioid overdoses than those that die from motor vehicle accidents. Let us discuss a little history about prescription drugs. People have abused substances for thousands of years. Valium, diazepam, was one of the earliest brands available and remains one of the most prescribed worldwide since launching in 1963. Valium is used to treat various conditions, such as anxiety and prevention of seizures from alcohol withdrawal, just to mention a few. It was not until the 21st century that prescription drug abuse became part of the drug abuse studies due to the increase in opioid abuse. Psychotherapeutic drugs prescribed for conditions such as anxiety, depression, and other mental illnesses were unknown until the 1950s. These drugs are prescribed to aid in mental, emotional, and physical health. Prescription abuse has increased rapidly over the decades. Prescription drugs are the third most abused illegal substance compared to marijuana. Prescription drugs are the fifth most abused substance compared to alcohol and tobacco. In 2015, the International Narcotics Control Board reported that Americans are responsible for 99.7% of the world's hydrocodone utilization. Prescription drug abuse in America affects 5.76% of Americans over the age of 12. In America, 16.3 million people misuse prescription drugs every year, with 2 million people, or 11.9%, addicted to prescription drugs. Among those who are addicted, only 12.7% acknowledge they're addicted. Why do people become addicted? There are many reasons why people become addicted. Peer pressure, physical and sexual abuse, self-medicating relative to stress, lack of a stable home environment. It's a big issue. Then there's changes in tolerance. The reaction to the prescribed drug decreases. The most commonly abused prescription drugs are stimulants, sedatives, and painkillers. Stimulants are prescribed to elevate a person's mood. It creates a feeling of well-being and increases energy and alertness. It is a performance enhancer. Examples of prescription stimulants include Adderall, Ritalin, Concerta, all prescribed for attention deficit disorder, ADD. The abuse begins when the stimulant is misused to stay awake to study for an exam, focus on work, or to control weight gain. Another use is that stimulants can also enhance the sexual experience. Misuse of stimulants is one of the top concerns on college campuses. College students report that stimulants are easily obtained and used to get high. Sedatives. Sedatives slow down the brain activity and make you feel more relaxed. They are prescribed to treat tension, anxiety, and sleep disorders. Examples of prescription sedatives include Xanax, Klonopin, and Valium. Sedatives become an addiction when your brain and body cannot function without the drug. A person will crave the drug and without it experience withdrawal symptoms. Addiction depends on the individual's level of tolerance. College students identify Xanax as a party drug. Let us explore the use and abuse of opioid medications, painkillers. There are three types of painkillers: opioid, nonsteroidal anti-inflammatory, and non-narcotic. Well, how do painkillers work? Painkillers access the part of the brain that controls pleasure and pain. When a person utilizes painkillers, they will feel relief and in turn experience mood elevation, which can lead to the misuse of the drug. What are the effects on the human body when taking opioid painkillers? Opioids are a narcotic pain medication. Opioid pain relievers bind to the opioid receptors in the brain, the spinal cord, and other areas of the body. This tells your brain that you're not in pain. They are utilized to treat moderate to severe pain, especially for people that do not experience relief from the previous mentioned non-narcotic classes. College students report that it is easy to obtain pain medication, which in turn is used to get high. Opioid addiction causes major social, economic, and health-related problems in America. Examples of the most commonly abused prescription opioids are Percocet, Vicodin, oxycodone, fentanyl, and hydrocodone. The National Center for Drug Abuse Statistics reports fatalities from opioid addiction increased more than 519% from 1999 to 2019. 50,000 people die every year from opioid overdoses. For example, 48,006 people overdosed on opioids just in 2020. Another fact, 3.1 million people abused opioids in the past month. Let's talk about side effects. Short-term side effects of opioids include the slowing down of the body function to include breathing and heart rate. The gastrointestinal effects include constipation, hardening of the stool, vomiting, nausea. Then there's the cognitive effects that include lack of focus, drowsiness, slow reflexes. It is recommended that you do not drink alcohol, take sleeping pills, or certain antidepressants or anxiety medications, as it could result in slowed heart and breathing rates. Let's talk about long-term side effects. They include physical dependence and addiction. The dose must be increased to receive the same effects because your tolerance increases. Withdrawal symptoms, if the dose is reduced or stopped, causing restlessness, muscle and bone pain, insomnia. Excessive use can cause liver damage, such as fatty liver disease. Cardiovascular issues, such as cardiac arrhythmias, or even heart attack. Death from opioid overdoses occur during an opioid-induced stupor when the respiratory system becomes depressed and breathing stops. What are the evidence-based treatment options for opioid addiction? Some physicians will try to wean the person off slowly, but in most cases it leads to a relapse. Effective treatment for opioid addiction includes medication, cognitive behavioral therapy, and motivational enhancement therapy. The Department of Health and Human Services officially declared the opioid epidemic a public health emergency in 2017, announcing a 5-point strategy to combat the abuse, misuse, and overdose. These activities incorporate evidence-based, promising, and innovative approaches to reduce the morbidity and mortality associated with opioid use disorder, including overdose, such as naloxone distribution, and other harm reduction services and medication-assisted treatment referred to as MAT. In the end, the magnitude of the problem means that prevention can now only be part of the solution. Thank you.